Welcome to everyone. My name is Bettina Borisch. I'm the Executive Director of the World Federation of Public Health Associations. I am here with Dr. Rüdiger Krech from the WHO headquarters in Geneva. He is a global health expert and he is the Director of the Department of Health Promotion. Welcome, Rüdiger.
Thank you. Welcome. Hello, Bettina.
I think and I know that you at WHO have been hyper involved into the pandemic, hyper busy. So now that we have already over 2 years, my question to you would be, what is your experience with the pandemic? And what have you seen as barriers, as problems? What could have governments done better?
Good question. And let me start a little earlier than this pandemic, because we had another epidemic and pandemic during this young millennium. I was very humbled to be the secretary of the review committee of the Ebola review in 2015. And having been involved in this work, looking what went right, but what also went wrong during the Ebola crisis in 2015, there were unanimous recommendations by global experts on what the world needs to do, what WHO also needs to do, but also what the world needs to do to prevent a next pandemic from happening and to prepare well should this happen. Out of those recommendations, very, very few were taken up, and very incremental changes were made, and we are now paying the bill for it. That the world knew that the risk was very high, that a pandemic would hit the world, and not preparing well enough the societies to then, once it hits the world, to react properly. So what are my lessons from the COVID crisis? Well, it's a mixed bag. I have seen, like many of you, especially at the start, very good signs of solidarity, and especially at the start also a quite good compliance with public health measures, which then in many countries evaded in many population groups. And I've then seen the fallback into very nationalist reactions. Solidarity was exchanged by charity. So especially when the vaccines were scarce at the start, then everybody looked at his own population first, and what couldn't be vaccinated then was donated. So a matter of charity instead of solidarity. Now, out of this, the world needs to learn. The damage that was done in many countries that politicized the crisis is huge, and has contributed to separating and dividing the world. Hate, misinformation, disinformation in the net was then very much spreading, and we in WHO had to face a pandemic above the pandemic, which was the pandemic of mis and disinformation, fake news, and that also is a lesson to be learned now when member states recover from this pandemic, how we need to reboot societies. So it's not good enough to just have a pandemic plan, but we need to see that all strands of society are affected by a pandemic, and every strand of society therefore needs to reboot. We cannot go on as before.
My question Were there barriers to your work as WHO?
We had a lot of these barriers, in fact. I'm, as you said, I'm heading the health promotion work of WHO, and that contains also the work on tobacco, on alcohol, on physical inactivity, on legal measures, fiscal measures, and of course all the settings, as that is where health is created or broken. Now, let me start with tobacco. Tobacco industry interfered at the start of the pandemic, claiming that tobacco smoke would have a preventative factor to not getting infected. I mean, how crazy is that? Right? So, I mean, that is abusing a crisis in which we are all suffering, where there's a lot of uncertainty as well. And the industry, which is criminal and which kills so many people, then had the guts to actually spread this misinformation knowingly. Another issue is, let's look at alcohol consumption. Also a mixed bag. While at the start of the crisis, we had seen a reduction in alcohol consumption, we had seen, especially in some population groups, younger people, throughout then the crisis, actually consuming more than before. In physical inactivity, at the start, people downloaded the apps and doing a fitness workout on screen, and did physical activities in their living rooms. Again, the longer the crisis went, the less people did this. In addition, parks were closed in the shutdown in a lot of countries and cities. And so you didn't have the opportunity of, going out, enjoying the nature and having physical activity as you should have. That has therefore led to more sedentary lifestyles and more chronic illness. And to mention also that because of the pandemic, many people with chronic illness did not receive the health services they needed. They were diagnosed too late, and we saw a lot of more morbidity and also mortality due to that lack of treatment. And last not least, going to the settings, to the everyday life settings where health is created or broken, and also where we gather experiences on empowerment, on community engagement, and health literacy. Now, health promotion was not really at the table when public health measures were decided upon, and that is very visible because they forgot about the key lessons in health promotion, which is a co-design and which is a community engagement. That means that with public health measures, you can give a framework at, let's say, a global level like WHO or a national level in countries, but you need to adapt it. You need to adapt it to your environment so that you are engaged as community and listened to what would work and what would not work in your community, your school, your hospital, your workplace, your restaurant, your hairdresser, so all that has been forgotten, and we could have added our experiences from health promotion on what works and what doesn't work in health promotion to these public health measures. And last not least, had the same effect of health literacy been put to the development of a vaccine, I'm sure that the compliance rates of vaccination would have been much, much higher.
Thank you for this. And you will be at the conference, the World Congress of Public Health in Rome, an invited speaker. You mentioned here a lot of challenges. What do you think, how can delegates who come to the Rome Congress use this meeting to help address some of these challenges?
So we need to understand that health is created or broken outside of the health sector, and especially the healthcare sector, right? So we need to better understand as public health community what the mega trends are. So first of all, what are these risk conditions, the commercial interests that we need to address, and not just for the bad, so to disinvest from the unhealthy products, but also to invest in healthy ones. And we need to much better understand and therefore have better skills of being able to advise the banking system, for instance, where they should disinvest and where they should invest in. The other is just looking at the technological transformation, a wonderful thing that we can use for public health. But there is also a risk that we're leaving some people behind who will not have access to this technological transformation, or just in designing the digital virtual spaces in which we will meet in Bettina in a couple of years' time, and I'm looking forward to that. But the way they will be designed can either be healthy or unhealthy. So we as public health community should be at the table when these technological innovations are now designed, and advise on how the world could look like when health is taken into account. And last not least, I was talking about the economies, and there we need to understand that we have planetary boundaries. It's not new, this idea. It actually comes from the Club of Rome in the 1970s, that they said, well, we need to be careful about the boundaries of this planet. And we in public health need to embrace this thinking now and advocate and work with macroeconomists on an economy that is nurturing the planet while we're satisfying the needs that we all have. If we do this, I think it will be a fantastic area of work to be in public health.
So your take-home message to the delegates in the Congress would be?
Let's think of what creates health. Let's advocate for this intersectoral cooperation that we then need in order to reach out to other sectors who are actually decisive in creating health, and not shy away from that area of public health at all. It's fantastic. We all know the do's and the don'ts now. It's just to make it happen.
So inspiring as you are, what would be your advice to young professionals?
It's, I think, the most attractive area you can work in. If you light the fire in yourself to actually advance people's health, you can do so much and so much more than we can do, let's say, in a hospital where we're treating individual patients. We can save lives with the public health measures that we do and create, and so be part of creating health and saving lives.
Public health has been high on the agenda with the pandemic. How could we even improve the position of public health?
I think we can improve in having of course, very heated debates amongst ourselves, because it's not a given that there's only one solution. There's many options in public health, and how you can actually advise politicians and decision makers. But once we have really debated hard, we need to come to a conclusion. And we need to communicate this very, very well, how we got to the different options, and how we got to the conclusions. And I think that this area of health communication needs to be improved amongst ourselves and between ourselves and journalists, because it's not entertainment when we're actually responding to a pandemic. It is serious work.
Thank you very much, Rüdiger. That interview was really a pleasure. And I wish you all the best at WHO, with WHO. Looking forward to meet you in Rome. Thank you, Rüdiger.
Thank you. Thank you so much, Bettina, and I'm looking forward as well.